2, 1. Hi, I'm going to take you through the setup of our Gen 2 dual channel Overstitch device. So the first thing you're going to need to pull for a case is you're going to want to pull the handle, which comes with the handle and the anchor exchange catheter. You're going to want to pull your box of sutures. Make sure that you have plenty of sutures for the case. You're also going to pull your cinches. You want to make sure that you have the exact number of cinches and sutures. They are a married pair. We are also going to pull a helix, an overtube, and the incisor scissors. These three items do not open. Keep them in the room handy in case your physician needs them, because you will not use them in every case. So the first thing we're going to do is we're going to open our handle. We take this out of the package, and this is the first thing that we're going to set up on our dual channel scope. As you can see, Boston packages this very securely to make sure that nothing moves or shifts during shipping. Once this is out of the package, we're going to take our handle, we're going to bend this down to a 90-degree angle. We're going to face the Apollo logo up to the ceiling, and we're going to place this little lip on this lip just below the channels of the scope. It's going to set in and click. The next thing we're going to do is we're going to take our actuation cable and make sure it stays separate away from our scope. We do not want it tangled. And we're going to insert our alignment tube into the therapeutic channel of our dual channel scope. It only fits in one channel, and it is the larger channel. After that, we're going to make sure that that's pressed down and nice and secure so it's ready for our case. After that, we're going to take our suture, our 2-0 suture, out of the package. We're going to take our cassette, and we're going to get our anchor exchange catheter out of the package. Once that's completed, we're going to take the distal end and we're going to snap it into the anchor. You're going to feel it click, and you'll also have an audible noise that lets you know you're attached. We're going to take a couple inches of suture out, and we're going to pull the rest out by the suture and not the actual catheter. We do not want to put undue strain where the suture comes into the anchor. Once that's completely free, we're going to take a little slack out of our suture, and we're going to put it down the orange channel in the scope. It only goes down the therapeutic channel, so we're going to push through. It doesn't matter if the cap is open or cap closed. That's more of a physician preference. We're going to go all the way down, making sure that we're careful not to knot our suture. And we're going to advance this until we see it come out of our channel. There it is. We want to create a little bit of a suture slack loop. We do that by advancing it and quickly pulling the catheter back into the channel. Once we've created it, we want to make sure that our anchor exchange catheter, the distal tip, is safely in the channel of the scope so we do not hit the anchor exchange or the anchor with our needle body. Once we're in safe position, we close our handle. We advance this anchor exchange until we hear and feel a click. Once that's done, we will press and hold the blue button, pull back about an inch, open our handle to ensure that we've successfully loaded from our anchor exchange catheter onto our needle body. We will close the handle, and this is ready to be passed to your physician for their procedure. Thank you.